All right. Janet, we're going to continue working on something that we've been working on for several weeks, a tell the story timeline about some medical trauma that you've been through. And you've done a fabulous job going through the story in our last two sessions. There's still some stuff I know coming up. And so part of the goal of this session is to have you start to tell a lot about the events that we've already cleared, just to see if something new is coming up, just a test. Make sure you're staying steady. And then as we continue on, I will be interrupting. I'm not trying to be rude, but we will take little slices of the story to make sure we're containing your emotional intensity. Okay?
Okay.
So, before we get started, let's put hands on the heart for just a minute and feel your feet on the ground and just connect to this present moment, being present to yourself, knowing that we're going to help you make even more progress today. And take a deep breath with me and a nice long exhale. And I ask for all the protection and compassion and whatever is highest and best for you today to emerge from the session. Let's take another deep breath together. And exhale. Really feel those feet grounded. Feel yourself in the chair. And call all of yourself to be present to how we'll explore this story today. So just to check back, we put everything into some container last time and we sealed it up really well. So in your imagination, pull that container out and remove the coverings, and there's a story in there and a lot of it we've worked on already. So I'm going to ask you to very quickly and briefly kind of start from the beginning again. We started when you were
on top of the world.
Yeah, okay. So let's begin.
Yes. I was on top of the world and everything was going really well in my life. And I thought I was in good physical shape because I exercised a lot and was quite strong. And then after a really good workout the next day, I started having some symptoms of shortness of breath and tightness in my chest. So I went to the urgent care. They squatted me to the emergency room. I was admitted to the cardiac. What's that?
I'm just going to interrupt you real quickly. Are you having any intensity in talking about these things yet?
All right. No.
Okay. Then
kind of dialing through it. I think I'm used to going through it quickly so that we move on. But
yeah, I'll stop you just to check. Okay. What happened next?
Yeah. So then at the emergency room, then they kept me overnight in the cardiac observation. And then the next day I did a stress test, and that's when we realized that something was really wrong with my reaction to the stress test was on their end, what they were seeing was alarming. It did not feel any differently to me than what I felt as long as I can remember. And I've always been very physically active and having shortness of breath and heavy breathing as soon as I start exercising has always been the way. So it took me by surprise when they said that something was odd. And then
stop right there. Just check.
Okay.
As you check into that part of the story, because you are telling this quickly, but I know I told you to.
Okay.
When you check into the shortness of breath at that part of the story and getting the news from them, anything left?
No, I'm good with that.
All right, then keep going. What happened?
Okay. So they said that they wanted to do a cardiac catheter, and they wanted to keep me, and I said no, because we had very special dinner plans that we'd waited months for. And so then my then fiance and I went out and had a great, lovely evening, and went back and had the test. And then I know we worked on going through at the after the test when um, I started bleeding and they weren't helping me, and it was kind of scary, but we worked through that. So I feel really good about that. I'm very good there. And then the surgeon came in and told me his story of what was wrong with me, and said that I needed a bypass. Um, and I was very anxious about getting it done, because I was in graduate school. My son was in his senior year and he was playing football. And this was August, and I wanted to get this taken care of. So I didn't go and get a second opinion. And, we worked through that, which was really helpful. Some lingering guilt about not having done that. And then, so I had the bypass, and I was supposed to be a star patient because I was in such great shape. And before the bypass, I went out and had a wonderful evening with my son, which was really special and very heartwarming under the circumstances of, when you're going to get your chest cut open and you don't know if everything's going to go well. But I always felt that things would go well. And so then I had the surgery and got discharged, and then started having some difficulty with my breathing, with pain that they told me that I shouldn't be having. And we worked through that because I had a lot of issues around that, and not being listened to, being dismissed. And so our work there went really well. Doesn't rile me up to talk about that anymore.
Not angry anymore.
Yeah, not angry about that anymore. And then, but they did start to look at what was going on with me, and I got some chest x-rays, and it turned out my lung was filling up with fluid. And so then they drained my lung, and that was like crazy painful. And they were also, again, not prepared to deal with me or take good care of me or be mindful of my physical feelings. And we worked through that, and that was really good, because I had a lot of junk there, because that was like, whoo, they hurt me. In fact, that's what the nurse said when he took me back out to my husband, or my fiance. He said, we hurt her today.
That's and didn't say before. So just pause a moment on that, because that's a new statement. Is there any intensity around that?
No, actually, that was one of the good things that came back up, was that this was a person who recognized that things had not gone well, and he shared that with Scott. So the emotions that it brings up are the emotions of being cared about, of somebody who did see me, who did see what I was going through.
Yeah, you keep uncovering these new little morsels along the
way. Yeah. And getting the junk out of the way and letting some light shine through. So then I had that problem again, and went and got x-rayed again. And they said they were going to send me home, and I was leaving the hospital when they called me over the PA, and then they admitted me, and then they put in a chest tube in my room. It was incredibly painful. The procedure itself was incredibly painful.
So take a look right now, just go back to that, because I think we're almost at the place where we stopped last time.
Yeah.
So the chest tube and that.
Yeah.
And also you said something before about a scraped nerve. So
right. When they put the chest tube in, there are nerves that run along your ribs, and they put it in so close on top of a rib that they scraped over a nerve and they twisted it.
Hmm. So where are you at on intensity right now as you say that?
I'm I'm kind of okay. I mean, I'll tell you what that brings up for me is that when I'm tired, um, that nerve will sometimes hurt. I had to treat that pain for many years. Wore pain patches for 2 years.
Hmm.
Um, got that kind of under control, but
So
um,
there's,
it does hurt, and it is one of the places that we tap. It's right there under my arm.
ooh, so maybe we need to do something with that.
Okay.
You brought up a couple things that it still bothers you, that it's one of those things to remind you. I don't know,
Yes.
when you focus in on that that nerve on the rib and what it means to you emotionally, is there an emotion or a thought?
There is an emotion, because as I told you before, they didn't prepare me for that. Then they didn't treat me for that. Um, and I had a terrible, painful night, and then continued to have pain. Um, and not only did I have pain, but I could not sneeze for over 2 years, because when I would go to sneeze, the pressure in my chest, um, my body would abort to sneeze. It couldn't handle the pain or the pressure.
So
Um,
as you think about the whole ball of wax of that scene where that all started, this is the origin story of that painful sneeze, and even the things that bother you today, that you get those little twinge. 0 to 10, where are you at about?
um, I'm actually, because of the work that we've done, about a 7. You
Okay.
know, I think before we had done this work, that would have been, well, you know, now that I say that, I think we can go 8.5 on the anger scale. You know,
Mhm.
there's a lot of emotions there, sadness, frustration, but it's anger. It is anger.
We start, let's just do some tapping and breathing around all of that. Deep breath and out. Eyebrow points. Deep breath and out. Side of the eye. Deep breath and out. And under the eye. Deep breath and out. Under the nose. Breathing in. And a nice long exhale. And under the lower lip. Breathing in and out. And collarbone points. Breathing in and out. Hand under the arm. Breathing in and out. Honoring that. Is it this side or the other side that
It's
has
this side.
so gentle? And on your heart with the gamut point, breathing in and out. Okay, so you had said, let's just check in on your intensity. You had said they didn't prepare me or treat me. And maybe that's a good name for this slice of the scene. Um, are you still at an 8? Where do you think you're at?
No, I'm probably still at a 6 though, because, you know, as I mentioned last time, that was really one of the worst nights of my life.
Okay.
Um,
Let's use some words around this then. All right. So tap with me. Even though they didn't prepare me for this,
Even though they didn't prepare me for this.
I had one of the worst nights of my life.
I had one of the worst nights of my life.
And it still bothers me sometimes.
And it still bothers me sometimes.
Lingering symptom.
I have lingering symptoms.
I deeply and completely accept all this anger.
I deeply and completely accept all this anger.
And all this upset around mistreating this problem.
All this upset about mistreating this problem.
And I choose to love and accept myself completely.
I choose to love and accept myself completely.
Even though I wasn't prepared for that nerve damage.
Even though I wasn't prepared for that nerve damage.
I endured the memory of the worst night of my life.
I endured the memory of the worst night of my life.
I choose to feel calm again.
I choose to feel calm again.
As I'm present to all the feelings and emotions of this.
Because I'm present to all the feelings and emotions with this.
Even though when I'm tired, that nerve will still flare up.
Even though when I'm tired, that nerve will still flare up.
It brings me back to that worst night of my life.
Brings me back to that worst night of my life.
I choose to release this memory.
I choose to release this memory.
In all the ways I've held it in my body.
And all the ways I've held it in my body.
Because I love and accept myself.
Because I love and accept myself.
And I have the capacity to move on.
And I have the capacity to move on.
In comfort.
In comfort.
Top of the head. They didn't prepare me.
They didn't prepare me.
For this lasting damage.
For this lasting damage.
They didn't prepare me.
They didn't prepare me.
The worst night of my life.
The worst night of my life.
Side of the eye. This memory of the nerve pain.
This memory of the nerve pain.
Under the eye. This memory of more pain.
This memory of more pain.
And all the times it comes back.
All the times it comes back.
Under the nose. This memory.
This memory.
Scraped rib.
Of my scraped rib.
Under the lip. All this anger.
All this anger.
About the scraped rib.
About the scraped rib.
All the ways I've had to hold on to this.
All the ways I've had to hold on to this.
I'm angry.
And I'm angry.
All the reasons that I have to be angry about this.
All the reasons that I have to be angry about this.
All the ways I'm justifiably angry about this.
All the ways I'm justifiably angry about this.
And deep breath in. All the things that didn't go right.
All the things that didn't go right.
I'm still angry about.
I'm still angry about.
Okay. Take a nice stretch now. Maybe a wiggle. Maybe you want to even rub those sides of the rib just to honor that part of you. See if there's anything that wants to move out of that area that is there. And help yourself to some water if it feels good. So when you think into that scene and that scraped rib and the pain, that worst night of pain, 0 to 10 right now, where do you find your intensity?
Somewhere between a 2 and a 3.
Okay, good. That feels better. So
yeah.
If you had to put maybe 1 or 2 words around that 2 or 3, what is it about now? What are you feeling?
I think the lack of recognition that that what I was saying, what I was going through could have even been true. There's just was so
Mhm.
much denial on the part of the medical team, and um, not
Yeah.
even thinking about, like, maybe this is really bad because things didn't, because this has not gone well, that things have gone wrong,
They should have.
and the lack of owning that.
Yeah. Yeah. Okay. Is it still anger then? Is that the right, or is it something else?
Indignation.
Hmm. That's your good word. Okay.
Yeah.
Let's use it. All right. Let's see if we can take it down a little bit more. Even though I'm feeling all this indignation,
Even though I'm feeling all this indignation,
because they denied what I was going through
because they denied what I was going through
after they had messed up.
after they had messed up.
And I've let myself feel it
I have let myself feel it
because it was wrong.
because it was wrong.
And it's okay that I held on to this.
And it's okay that I held on to this.
It was big.
It was big.
And I love and accept myself whether I hold on or let go.
And I love and accept myself, whether I hold on or let go.
I'm carrying this angry indignation
I'm carrying this angry indignation,
that I deserved so much more than this.
but I deserved so much more from this.
And no patient should ever go through what I went through.
No patient should ever go through what I went through.
Clearly malpractice.
Clearly malpractice.
And I suffered.
And I suffered.
And I choose to honor all of that,
And I choose to honor all of that,
whether I hold on to it or whether I let it go.
whether I hold on to it or whether I let it go.
I do have my power to do what I want with this,
I have my power to do what I want with this.
even though I'm still suffering this angry indignation.
Even though I'm still suffering this angry indignation,
And there's a part of me that wants to hold on to it.
there is a part of me that wants to hold on to it.
They were very wrong.
They were very wrong.
And I was mistreated.
And I was mistreated.
And I honor all of my feelings and memories
And I honor all of my feelings and memories
as I relax and love and accept myself.
as I relax and love and accept myself.
And I can let this go or I can hold on to it forever.
I can let this go or I can hold on to it forever.
Top of the head. Lack of recognition.
Lack of recognition.
All this indignation.
And all this indignation.
Eyebrow points. Angry indignation.
Angry indignation.
Side of the eye. The irresponsible medical team.
Irresponsible medical team.
Under the eye, holding them responsible.
Holding them responsible.
Forever.
Forever.
Under the nose, indignation.
Indignation.
Under the lip, irresponsible.
Irresponsible.
Collarbone points, indignation.
Indignation.
Under the arm, gently. Somebody's got to be accountable.
Somebody's got to be accountable.
My body's keeping score.
My body is keeping score.
Maybe it's time.
Maybe it's time
to be comfortable.
to be comfortable.
But I can keep score too.
I can keep score too.
I'll hold on to what I need to hold on to.
And I'll hold on to what I need to hold on to.
It's all in my power.
It's all within my power.
Okay. All right. Check in with yourself now. Were those words appropriate?
Mm-hmm.
Yeah. So what are you aware of right now?
The need to forgive myself for when I've been a nurse and made mistakes.
Okay. Oh, so you're moving on to something else. So, yeah, side of the hand. Just breathe with me. Whew. Breathe. You don't have to say this with me, but just hear the words. Even though I'm realizing I have made mistakes, and it hurts. I love and accept myself as the truth comes out. Even though I'm feeling this pain of realizing my own mistakes. I hold everybody to high professional standards, including myself. And I still love and accept myself with these mistakes. Even though I've made mistakes. And it breaks my heart to realize it. I accept that I'm not perfect and that I can make mistakes just like other people do. And that I'm still lovable. I don't have to be perfect. And I recognize my mistakes and I care about others to the extent I would never intend a mistake. And I would always apologize for a mistake. I'm doing the best I can. And it's such a big job to take care of other people in healthcare, right?
Yes.
Let's just say that. It's such a big job to take care of other people.
It's such a big job to take care of other people.
Take it so seriously.
Take it so seriously.
Eyebrow points. It's such a big job.
Such a big job.
And there can be unexpected things.
And there can be unexpected things.
Like make mistakes.
And make mistakes.
Other people make mistakes.
And other people make mistakes.
By the eyes. It's complicated. It's hard.
It's complicated and it's hard.
Good nurse and I make mistakes.
I'm a nurse and I make mistakes.
So do other people.
And so do other people.
Just like me.
Just like me.
Under the eye. But I mean well.
But I mean well.
I still made some mistakes.
Still made mistakes.
I can't undo them.
I can't undo them.
I can be sorry.
I can be sorry.
Under the nose. And I feel bad about it.
And I feel bad about it.
And I hold other people responsible.
And I hold other people responsible.
For their mistakes, just like I hold responsible.
Just like I hold myself responsible.
Under the lip. I'm harder on myself.
I'm harder on myself.
Most people.
And most people.
It's hard taking care of other people.
It is hard taking care of other people.
I have a hard time taking care of myself too.
I have a hard time taking care of myself too.
I'm working on it.
And I'm working on it.
It's hard taking care of other people.
It's hard taking care of other people.
Medicine is a big challenge.
Medicine is a big challenge.
For really responsible people.
Really responsible people.
I'm always doing the best I can.
Always doing the best I can.
I want to believe everybody else is too.
And I want to believe that everybody else is too.
People who go into medicine are taking on a lot.
People who go into medicine are taking on a lot.
And it's hard to be perfect.
It's hard to be perfect.
All right. So you were worked up there a minute ago. How are you doing now?
Good. Really good.
Do you need
Yeah.
the water?
Yeah.
Now, that kind of came out of nowhere. Why do you think that came up there?
I think it came up around forgiveness for the mistakes that were made, and in trying to find forgiveness for them.
Mm-hmm. So where are you on forgiving them for that thing with the ribs?
I'm really good. Really good. Yeah.
Good.
And that was probably a sticking point of my not being able to forgive them, because maybe I didn't give that to myself first.
Mm-hmm. Yeah, that's
That
big.
was
Yeah.
that was big.
So do you think when you go back to the just the chest tube rib scene, is there anything left? You were 2 to 3 when we checked in before. What do you notice now? You feeling
No, I think I'm really good with that. That was a lot.
okay? Well, I don't think I'm going to have you start the story at the very beginning. How about if we start retelling at the first time they drained your lung, and then
Okay.
does that start there feel neutral right now?
Yeah. Yeah.
All right, and then we'll see
Okay.
how it goes.
So they drained my lung, and it was like super painful. And and I survived it, and I've moved on. And so then I had the second episode, and I knew something was wrong, and so I went, and they um, looked at it and admitted me, and put in a chest tube and scraped it across my rib, and that was like really painful.
Right,
And
just
then
stop and just check that moment. Check it. Yeah, you,
okay,
you can vividly imagine it again, just in your mind. Is there anything there that still needs attention?
no,
Okay.
no.
And what happened next?
And then I went through that night of them not wanting to treat my pain. Just I don't know why, just not recognizing it, or just not wanting to call the doctor in the middle of the night, or whatever it was. I'm sure that she was not trying for me to suffer.
Mm-hmm.
Um,
As you imagine that night and yourself in the bed
yeah,
and coming up
and
beyond that.
actually, just kind of a good thing that I remember my mother really advocating for me,
Mm-hmm.
and that's not a relationship that we've had a lot of in our life. And so that was a, a moment, uh,
Mm-hmm.
you know that something good came out of that I got to experience that from her.
Good. And what happened
And
next?
and then I was just in the hospital for some days, and then finally they decided to drain it again, in a, I don't know if it was a surgical suite, or I don't think it was a surgical suite. It was, they were going to do it with some sort of observational machinery. And again, that was one of the better moments, because I'd been hanging out in the hospital, not making progress. And they gave me some kind of injectable drug that was the first pain relief that I had had the whole time. Like, really, like, serious, the pain is gone, pain relief.
So there's
And
intensity
and
around
that,
this scene, this part of the scene. Then this is something that went right. You're just
yes, this is something that went right. And on top of that, the person who was doing it um, was like, hey, and you didn't even take all the medicine, so here, you can have it and take it with you. And I was like, oh, finally, somebody who's not afraid to give me drugs. So then they got that drained. And so I was getting ready to go home, and a nurse came in who hadn't been there all week. I'd been there for a week, and she came in, and she looked at me, and there was all this tubing attached to my drainage machine from my lung, because they put all this extra tubing on it so that I could take myself to the bathroom, so they wouldn't have to help me to the bathroom. And the machine was like beside me. And so I had never really been looking at it, but all these people had come in to look at it. And she said, you can't have all this extra tubing. And she picked up the machine and she showed it to me. And she said, you see this ball, it's supposed to be between these two lines. It's not supposed to be hanging down here. You haven't even had suction on you the whole time you've been here.
So let's
And
stop
I was just like, whoa, yeah.
right now before you say much more. So something about the ball and too much tubing. Where are we at now?
That's like a 6, because the respiratory therapists had come in, the nurses had come in, the doctor had been in, the nurse practitioner had been in, all of them had been in, and it's their job to look at that machine that's supposed to be suctioning the fluid out of my lung.
Okay.
And no one recognized that
So
they'd hooked it up
even
ineffectively.
a parade of practitioners
A parade of practitioners
should have looked at that tubing.
Who should have looked at that tubing.
And they failed me again.
And they failed me again.
I deeply and completely love and accept myself.
And I deeply and completely love and accept myself.
Even though all these practitioners had a chance to check this, but they didn't.
Even though all these practitioners had a chance to check this and they didn't.
And here's another problem.
Here's another problem.
I'm still upset about it.
I'm still upset about it.
Deeply and completely love and accept myself and all my feelings.
I deeply and completely love and accept myself and all of my feelings.
Even though this new part of the story,
even though this new part of the story,
it's another example that they didn't do their jobs.
One more example where they didn't do their jobs.
Should have known better.
They should have known better.
And I'm the one that pays the price.
And I'm the one that pays the price.
I deeply and completely accept myself.
I deeply and completely accept myself.
All the anger and frustration.
All the anger and frustration.
And all the reasons I can't forgive them.
And all the reasons I can't forgive them.
They should have checked.
They should have checked.
They didn't.
They didn't.
Eyebrow points. There were lots of them. Doctors.
There were lots of them.
Techs and nurse practitioners. They should have known.
They should have known.
So somebody didn't do their job.
Lots of people didn't do their job.
Onto the eyes. Lots of people didn't do their job.
Lots of people didn't do their job.
Under the nose. Lots of professionals that should have known better didn't do.
Lots of professionals who should have known better.
Under the lip. I don't expect perfection, but a team should figure this out.
I don't expect perfection, but a team should have figured this out.
Collarbone points. But once again, I'm the one.
And once again, I was the one.
It's like I was doomed from the beginning.
It was like I was doomed from the beginning.
With teams that didn't know what they were doing.
The teams that didn't know what they were doing.
It's like I'm attracting people that don't know what they're doing.
It's like I'm attracting people that don't know what they're doing.
Don't check.
Didn't check.
Don't talk to each other.
Don't talk to each other.
This is malpractice.
This is malpractice.
No wonder I'm so upset.
Again?
No wonder I'm so upset.
No wonder I'm so upset.
All right. So let's see. You were like a 6 when we started. Just check in to see what is the feeling right now. If there was one emotion or one word.
Disappointment.
Mm-hmm. Disappointment in what or who?
Disappointment primarily in the surgeon and the nurse practitioner. The work that they did was what got me to that point. And then, I was there under their direction, under their treatment orders. And, he came in and he lifted up that tube every day. And, it's a very simple machine. In fact, once the woman had showed it to me, I remembered taking care of patients with that machine.
So what
And
are you at an intensity 0 to 10?
I think just like a 3, just like
Right.
just low grade,
Let's
irritated.
disappointment feeling. Okay. So even though I have this disappointment,
Even though I have this disappointment,
I can still see him lifting up to check that tube.
and I can still see him lifting up to check that tube.
The surgeon and the nurse practitioner messed up.
The surgeon and the nurse practitioner messed up.
I accept all this disappointment.
I accept all this disappointment.
And I love and accept myself.
Because I love and accept myself.
Even though I'm still feeling disappointment.
Even though I'm still feeling disappointment.
Because the surgeon and the nurse practitioner should have known better.
Because the surgeon and the nurse practitioner should have known better.
And I even know better.
And I even know better.
I know how easy this would have been.
I know how easy this would have been.
And I choose to accept all my feelings.
And I choose to accept all of my feelings.
And release what I don't need anymore.
And release what I don't need anymore.
Even though I'm still disappointed.
Even though I'm still disappointed.
And I can hold on to this as long as I want.
And I can hold on to this as long as I want.
Because they should have done better for me.
Because they should have done better for me.
They looked at that tube. They should have known better.
They looked at that tube. They should have known better.
And I'm left disappointed.
And I'm left disappointed.
But I also love and accept myself now.
But I love and accept myself now.
And maybe it's time to let this go too.
Maybe it's time to let this go too.
Top of the head. This disappointment.
This disappointment.
Eyebrow points. This disappointment about the tubes.
This disappointment about the tube.
Yeah, inside of the eyes. This disappointment.
This disappointment.
And this disappointment in the surgeon.
This disappointment in the surgeon and the nurse practitioner.
Under the nose, both of them disappointed me.
Both of them disappointed me.
Under the lip, and I was disappointed. I thought I was finally getting better.
And I was disappointed. I thought I was finally getting better.
I have another problem.
I had another problem.
I'm disappointed that I can't trust them yet.
And I'm disappointed that I can't trust them yet.
After all we've been through.
After all we've been through.
I'm still disappointed.
I'm still disappointed.
What'll they do next?
What would they do next?
What do I do with all this disappointment?
What do I do with all this disappointment?
All right. Take a moment to check in with that aspect of disappointment, and that part of the story.
Yeah, it's gone neutral.
Okay. So I think because we've reached a point in time when we need to wrap this up, I know there's probably more to the story. Is there, or are we at the end? Or are we still at
well, the story, actually what we're working on goes on for
it goes on
days, but as far as that particular chapter of it being in the hospital like that, that's pretty much it.
Okay. All right. So hand on the heart for just a second and honor the good work you did today, and bring in the images of your mother supporting you. And I think we also covered that you realize that it's a hard job to be a medical practitioner or a nurse, and honor that you are able to forgive yourself, right, for those mistakes you've made. and the people who aren't perfect are still lovable and can be trusted. You're certainly one of those, aren't you? So you make,
I like to think so.
yeah. And is there a color you want to bring in right now to just wrap around that little nerve area? What color would be good to just wrap a little energetic bandage around that?
Silver.
Silver. Okay, so a silver something, whatever material you want. Just
The color silver.
yeah. So just imagine that wrapping around perfectly around that painful place that was nicked, and also just around all the memories in the past, so that you have a sweeter past there. How does that feel? Can you imagine that?
Mm-hmm.
Yeah. All right. So you have a container somewhere to put the rest of the story in. So what is that?
A basket.
Basket. Okay. So in your mind, gather up what's left, put it into that basket. And do you have a way of sealing that basket that keeps it
Has
safe?
a lid on it. It's a basket with a lid.
Do you need any tape or anything, or is that good enough?
It's a heavy lid.
Heavy lid. All right. And go ahead in your mind, put that basket in a very safe place till next time. You got it done? All right.
Mm-hmm.
Okay. Well, nice job, Janet. We will continue on this probably at some point in the future, but thanks for sharing the aspects of this story today.
Thank you.